Hi, my name is Lorne Brown. Welcome to healthyseminars.com. I'm your founder and host today. I'm also clinical director of AcuBalance Wellness Center in Vancouver. And I want to do a little housekeeping before we start our lecture for today. So let me just pull up what we have in our resource page. Today, we're going to be having Jonathan Shubs present to us. And it's the UAT, the Unified Acupuncture Therapy application of the Ching Balance Method and SAM Acupuncture for the period of COVID-19. What I want to let you know is on healthyseminars.com/resources, we keep adding and updating this page. So we have now added, so you can see we got telehealth, free topical webinars. We've now added a section called TCM Knowledge in COVID-19 discussions, different from classical Chinese herbal principles and action in response to COVID-19. So the herbal stuff, for the most part, will show up here, Chinese herbal. And then just TCM and naturopathic knowledge will show up here. And so when we click here, I just want to let you know several webinars have been added. So here's today. We got coming up with Ed Neal, the Neijing perspective on epidemic and pandemic diseases. We have a talk from the microbiome people, the megaspore probiotic people, talking about the cytokine storm and inflammation. And we also have Heiner Fruhoff, which this would fall into herbal as well, but Chinese medicine response to COVID-19, a summary of treatment approaches used in China. So we keep adding stuff to the resource page. So please keep checking out the resource. We keep updating it. When you scroll down, you can see a list. We usually put about a week ahead. So you can see just all the fun stuff that is coming up. This week we got Jonathan right now. We got a classical herbal class on Thursday. We got a throwback Thursday with the late Ray Rubio. You need to come to this. This one will open your heart in a good way. And then the Integrated Fertility Symposium that was canceled. We are streaming live webinars from a few lectures that were planned for IFS 2020 that got canceled. So they're now streaming. On Friday, we got the founder of Bastyr, Joseph Perzano, talking about the 9-week fertility detox program. We got Jacqueline Chassey on Saturday doing a functional medicine naturopathic approach for fertility. We got Randine Lewis on the Sunday doing the 3 Dan Qian. So this is a really kind of a self-care approach talk. And then the following week, down on the April 26th, the last one from the IFS will be Robin Murphy, a naturopathic approach, again, looking at genetics. So I just want to let you know about that. Also, I want to let you know that Jonathan Shubs has got a lot of content on healthy seminars, and all of his courses are available on demand, approved for continuing education credits. And during the month of April 2020, they are on sale at 25% off with the coupon code HEALTHY25. So this is his approach of the balance and SAM method and his modification. So all these talk about his approach. So you can see one on anxiety and insomnia. That's relevant now more than ever. This one we just released this week. So if you've been doing Jonathan's courses, they just released this one. Clinical occupations of SAM, 4 needles, and the 5 elements using abdominal palpation. And then we got other elements using this approach, and then thoracic outlet. It's just thoracic and facial problems. So I just want to let you know that we got a lot of stuff from Jonathan on healthy seminars. All right. Jonathan's running study groups. He's somewhere in Europe. It's like really late for him. He's always teaching. He's always around. And when I spoke to Jonathan, what we're doing at Healthy is creating community, right? So we want you to be together here. We keep the recordings up for 48 hours because we want you here at the live webinar. So community, unity, immunity. So thank you guys for showing up. We know for time zones, it doesn't always work. So we keep it up for 48 hours because, again, we don't want this to sit on your shelf forever because that's what free stuff often does. So we give you 48 hours to really motivate you to watch it because you got 48 hours. And we don't really want you to do it in isolation these days. We want you to do it with us. One thing I wanted to be clear, and I talked to my team when because of it's COVID time in our world at the time of the recording, we wanted to make sure this was more about treating based on Chinese medicine principles. So we're not treating a disease. That's not our approach. We're treating the individual and how they present, whether they have X, Y, Z, or ABC, because that's kind of the Chinese medicine approach. And so when I asked Jonathan to join us, I said, as long as that's how you're teaching it, based treating the individual, then I'm interested to share principles that we can use for our family because right now most of you are in isolation, not seeing patients. So what he's going to share today is really to help you help yourself and your family members. So without any further ado, I'm going to pass you on to Jonathan. Oh, thanks for that reminder, guys. We do need to share with you the disclaimer here. So read this carefully. Verbally, what it says is that this lecture is for educational purposes only. This lecture is not medical advice. This material should not be considered medical advice. If you have a health condition, if you have a diagnosis of disease, if you have an ailment or illness, seek out a healthcare provider, because this content is for educational purposes only. If you have questions, you raise your hand digitally and we will turn on your mic so you can have a conversation and ask your question with Jonathan. So there's a raise hand option at the bottom of your screen during this live webinar. And at the end, as you know, we'll open up our mic so we can connect with each other, because we really want to keep that community going. I think for the emails I'm receiving is this has been really beneficial, not just the learning, but the connecting and seeing each other, because we are in the time of physical distancing, staying at home orders. However, we can still have social solidarity and social innovation while we're physical distancing. So Jonathan, we're going to bring up your slides, and I'm looking forward to hearing what you have to share.
Okay, is that good? Perfect. Thank you, Lorne, for the introduction and for organizing this. It's great to have community. We're all over the place, and it's nice to be able to come and meet with each other and to share. So maybe I just introduce myself a little bit. I'm Jonathan Shubs. I have a practice in Lausanne, Switzerland, and I also created and I teach the unified acupuncture theory, which is a mixture of taking in balance method, meridian interactions, master tongue, 4-needle 5 elements, Sa'am approaches, and other types of acupuncture to come up with a global approach to how to connect them all. And so today I'm going to be talking about how within that approach, within the UAT system and our main treatment principles and protocols, how we would help to treat during this period. And not necessarily people who are physically affected at the moment. We will look at that, but it's also for the general psycho-emotional aspects of it from a TCM point of view, and also some prevention and how we can help build up our Wei Qi to better prepare ourselves, etc. So we're going to be looking at 3 different key parts to it. So the first is, how can we support the Wei Qi? Here I wrote immune system, but in Chinese medicine, we're really talking about Wei Qi. So we're using either the 5-needle 4 elements approach or the I Ching Bagua approach. How can we build up the body's ability to better respond to the environment? The second part is going to be about navigating the emotional impact of this situation. It also goes forward into other situations also. So there are 2 different ways in which we work with emotions in the Sa'am approach. One of them is where we're going to be looking at how we're going to be tonifying some of the yang meridians and dispersing the yin meridians. I'll get more into that when we move closer to that section. And then the last part is, if you do see somebody who has an external viral attack, like a Tai Yong attack, how can we treat the patient? So this would probably be, at the moment, it would be a family member, somebody who you're in quarantine with. Or there's also the possibility, we're also going to look at when somebody has finished going through a attack, either it being Tai Yong or Yong Ming or Xiao Yong, how can we help the body to reestablish itself? And once it's come out of that, how can we help the body to come back to its basic functions better? So those are going to be the 3 different aspects. And so we're going to start now with looking at how can we support the Wei Qi system. Now, the Wei Qi idea is mainly seen in the lung meridian. So the Tai Yin lung meridian is the key meridian associated with Wei Qi. So the first thing we're going to do is we're going to look at using the 4-needle 5 element approach in how we can support the lung meridian. So I'm going to talk just a little bit about what the lung meridian is, or how we do it in the SAM approach, and the way that we choose only 4 needles. So we start with our normal 5-element setup, and we go into the idea of the statement that the parent nourishes the child. So when the metal, which in this case is the child, is the affected meridian, what we're going to do is we're going to look at what element has the parent relationship to it. So we have earth nourishes metal. So what we do is on the metal meridian, we look for the point that is the earth point, because that is where earth can actually send information or send help to metal. So the earth point here is lung 9. So what we will be doing is we'll be taking lung 9 and we'll be tonifying the meridian lung 9. So, and we'll be supporting that with the earth point of earth. So this way the parent's earth point is the point that can send out the information, and then the earth point in metal can receive it. So we will be tonifying, let me just get this up. So we'll be tonifying tonifying is probably the best word for it. So we'll be tonifying spleen 3 and lung 9. So we'll also be tonifying here. Okay. Now, in the UAT SAM approach, whenever we're tonifying a needle, and I'm not going to go into all the tonification techniques, those we should already know, insertion, how they're breathing, etc. But one thing that is specific to this UAT approach is that when we're tonifying, we're doing it on the left side of the body. So these 2 points, spleen 3 and lung 9, will both be on the left side of the body. Okay. So there we have our 2 points. And that's the first part of the SAM approach, is bringing in the parent to support the child. The second is if you can imagine, the idea is the child has 2 main other elements that have an influence on it. So for example, the earth has an influence on metal as being the parent, so it supports it. Whereas fire's relationship to metal is that it controls it. It's able to bend it to its will. Now, if the metal is in a weak state, we want to reduce that effect. So this is the grandparent controlling the grandchild. So the 2 points that are linked to the controlling relationship are going to be dispersed. So just like we did for the 4 needle, for the tonification aspect, for spleen to lung, we're also going to look at the element that supports metal and the element that controls metal. And the element that controls metal is fire. So we're going to look for the fire point in metal, and the fire point in metal is lung 10. And what we're going to do with this is we're going to disperse this point, and we're also going to disperse heart 8. And by doing this, what we're doing is we're sending back the excess fire chi back to fire. So we'll be dispersing our sedating, okay, lung 10, and heart 8. And in the UAT system, when we're sedating, we're doing this on the right side of the body. Now, I go into explanation of this is that the left side is more linked to blood and more linked to nourishing, and the right side is more linked to Qi flow, and it's more linked to getting rid of or to letting go of excesses. So we reduce the right side, or we sedate the right side, and we tonify or supplement the left side. So that would be our treatment. So our treatment would be, the first needle we would put in would be lung 9 on the left side, followed by spleen 3. And then we'd go to the right side, and we would sedate the point lung 10 and sedate the point heart 8. So an interesting way to think about this is the idea of what Wei Qi is doing. Now, Wei Qi flows in that area between the skin and the muscle. That's where it's supposed to be going. And we can give this idea of it being armor. And when you think about what you need armor to do, armor is traditionally made of metal, so it makes sense that we would be tonifying the metal element. But for armor to be usable, first of all, it has to be, what's the word I'm looking for? Flexible, okay? It has to be able to move with the body. And Earth's element is almost like a humidifying. So it's like the grease, it's the oil that allows the metal to move. So by bringing in Earth, we're allowing the metal to move, and we're allowing it to be flexible and respond to the moment. But at the same time, fire's influence on metal is that it makes it too weak. It makes it so that we can bend it and we can change its form. And what we need is we need the metal to be strong and to be able to move, the armor to be able to move. But if it's too hot, it's going to start to bend and not hold its supportive aspect. So we can see even from the image of the armor, we can understand why tonifying metal, which means tonifying the lungs in this case, would be such a useful way to help us prepare for whatever the environment brings to us. The idea is not that we're going to fight the environment. The idea is that we're building up our body to be able to respond to it better. And the Wei Qi in the metal is our first main response mechanism to the external world. So that's what we're looking at with this treatment. So this treatment only has 4 needles. So on the left side, you could be doing spleen 3 and lung 9. On the right side, lung 10 and heart 8. So this, you can also do it with acupressure on yourself. I do it on myself. I've been doing it on my children these last couple of days. It's a really easy treatment because you're only using 4 needles. And also, if there's another underlying pathology or an underlying reason to treat the person, you can add that on top of it. What's interesting about the SAM 4-needle approach is then you can add in any other system you want. You can add in auricular therapy, you can add in traditional TCM, you can add in anything else that doesn't require a specific order of which needles go on which side, which is in contrast to the I Ching Bagua we're going to see after. So this is also a good treatment when you also want to help the person better respond, and at the same time, you have other underlying problems that you're wanting to address with the patient. Okay, so that is how we would tonify from the 4-needle 5-element approach, the lungs, and through that, the Wei Qi. Okay, now the other treatment that we can use to treat the Wei Qi and to help the body better respond to the environment is a more structured approach, which comes from the I Ching Bagua system. So the I Ching Bagua system, in this case, we're going to be using meridians of Tai Yin. So we're going to be seeing the lung and the spleen again. And the other meridian that can be very useful in this case is Yong Ming. Yong Ming is the beginning and the end of the whole food process, right? So the stomach is the first organ or meridian to get in contact with the external physical world through food. And the large intestine is the last one to expel it. So we're also here working at this idea of being towards the exterior, or the most the part of the body that has the most reaction to the environment, the external environment. So we're going to be using Tai Yin and Tai Yong. And when we do this I Ching Bagua, I'm not going to go into how we get all the points here. But when we've decided on our 4 meridians, what we do is we have a pattern of going yin, yang. So one arm meridian will be yin points, and one arm meridian will be yang points. Now the arm that was yin, that associated leg will be yang. And the arm that was yang, that associated leg will be yin. So we have this pattern of going yin, yang, which creates a balance, creates a structure, and it also creates lots of movement. So on either side of the yin, so this is a yin arm, we have a yang leg and a yang arm. And then on a yang arm, we have a yin leg and a yin arm. So we're going to be going yin, yang, yin, yang. Now, when we take a look at the indications for the Tai Yin, Tai Yang Ming, we do have some indications based on the 6 stages, so high fever, profuse sweating, extreme heat. But more interesting is that we have it for the metal earth affections, which are digestion, rhinitis, asthma, allergies, and dermatological problems. And all of these problems are closely related to the functions of Wei Qi. So the Tai Yin is going to help the body come up and protect itself or to better interact with its environment. So without going into too much explanation of these are the guas that are associated with each meridian and then how we interact with them, we find that the points that come out for this pattern are going to be lung 5 and lung 9 on the lung meridian, and liver, large intestine 3 and large intestine 11 on the large intestine meridian. So one arm will have these lung points, lung 9 and lung 5, and the other will have large intestine 3 and large intestine 11. And then we'll have a leg that will have the spleen points, so spleen 9 and 3. And the other leg will have stomach points, which are stomach 43 and stomach 36. And we can see here that it's written a 3-6 pattern. When we mean a 3-6 pattern, it means that we're using the third point going from distal to proximal. So the third point on all of these is going to be lung 9, large intestine 3, spleen 3, and stomach 43. So there's a pattern amongst them. And then when we see the 6th point, we're going to be using the Husi point for the 6th point. So we have stomach 36, spleen 9, large intestine 11, and lung 5. And this pattern is derived from seeing how these guas, how these hexagrams that are associated with each meridian interact with each other to give us these points. So we've come up with, the pattern is based on a couple of different principles. First, we have the yin-yang axis. So we have that as our structure. Then we look at the hexagrams to decide on our points, which gives us a 3-6 pattern. And we also have to make sure that the meridians involved interact properly with each other. And there's a couple of different patterns that allow us for the meridians to interact. And here we have this cross and box in the middle means that the lung meridian, it interacts with large intestine. So lung and large intestine are an interior-exterior relationship. From the UAT system, it's called system 1. If you study with Dr. Tan, he has a different numbering system, but this is interior-exterior system 1. We have lung interacts with spleen, which is the full meridian, Tai Yin of the hand interacting with Tai Yin of the leg. This is system 2. And then we have we also look at these meridians as where they are in the body. So the lung is a front meridian. If you look at your arm, you have your lung in the front and the lung yin front and large intestine yang front. And in the thighs, the spleen is in the front on the inside and the stomach is in the front on the yang side. So system 3 is about using the opposite limb and the opposite polarity. So this is a yin meridian, we're going to look for a yang meridian, and it's an arm meridian, so we look for a leg meridian in the same position, so it's in the front. And this is called system 3's closed circuit meridians, which we find in the Manaka Japanese system. So we can see that lung has interactions with all 3 other meridians, and large intestine is going to interact with lung interior-exterior, it's going to interact with stomach, system 2, Yang Ming of the hand, Yang Ming of the foot. And it interacts with spleen, as I said before, the front interacts with the front. We go from arm to leg and Yang to Yin. And then spleen has the same interactions with lung and large intestine and stomach also. So we have all of these meridians interacting very closely together, and they're all presenting this united front. So we have 2 treatment possibilities. We have the Tai Yin Yang Ming, which in some ways is a more global treatment, right? You're treating yin, you're treating yang, you're treating the arms and the legs. But it's more structured. So we can't use other arm and leg points, or we can, but it's more complicated to apply them because you have to know which ones you can use. So you can add abdominal acupuncture or body acupuncture as long as it's on the limbs. You can add scalp acupuncture, auricular acupuncture. but it's more of a set system, these 8 points. Whereas the first one is a little bit, it's just concentrating on the lungs and just concentrating on supporting metal's defense mechanism and being able to respond better to the environment. And it's more pliable. We can add other things into it more easily. So if you're looking for just a simple one-off immunity, a Wei Qi treatment, this would probably be your best bet. But if you want something a little bit more subtle, where you want to bring in other problems, then you use the lung protocol, and then you can add whatever else you're doing, because it doesn't have that same need with it. So those are 2 treatment systems. One's from the 4-needle 5-element SAM approach, and the other from the I Ching approach. And both of them have very similar outcomes, as we're helping the body respond to the environment. So they're good in preventative areas or situations like we find ourselves now, where we want to build up our body's ability to respond. And those are 2 general treatments for that. Okay. And of course, you can do these. Best would be acupuncture, but we're not doing acupuncture at the moment, or you can do it with your family. It depends on where you're situated. Other than that, you can also do these with acupressure. You can do them with different types of massage, etc. So you can also help your patients by giving them this as acupressure for them to do at home if you're giving them online consultations. So the second aspect of what we wanted to look at today was more talking about what we say helping with psycho-emotional problems. And this is the psycho-emotional aspects. And well, traditionally we say, I think it's 70% of all internal problems come from emotions. That was one of the statements I remember hearing when I was learning Chinese medicine. But how do we actually interact with the emotions from a level of acupuncture? So for this, we use the 4-needle 5-element SAM approach. And before we go into it, one of the things I should explain to you is that we have a little bit of a different understanding of emotions, or we see emotions differently. We don't give an emotion a positive or a negative connotation, right? So we associate each emotion with a function. So when you have an emotion, every emotion is valid, and what it's doing is it's your body's responding to have you have a certain reaction or to have a certain function in relationship to what's happening. So we don't look at the emotion as negative. What we do is we see is when there's too much of it or not enough of the response, then we can get involved. So we look at each emotion that's associated with the 5 elements, and we look at them and saying, when the person isn't responding enough to that type of stimulus, when they're not responding that way, what we want to be doing is we want to be tonifying the Yong aspect of the element. Because Yong is much more about movement and much more about action. And when we have a emotion that is too strong, where we're over-responding to it, and that's the only filter in which we respond to the world, then we want to be reducing the yin. So I know traditionally we think about the emotions and we talk about sadness and fear and overthinking and anger, and then we associate them with the yin meridians. But we should be associating them with the actual element. And then when they get in excess, that is when there is an association to the yin meridian. But when they are not expressing themselves enough, or they don't have the ability to express them enough, we want to be connecting and tonifying the Yong element, the Yong part of that element. So first we're going to look at when people aren't responding with enough, so I don't want to put a judgment of enough, but when people are not necessarily completely responding, or they don't have access to the response, we're going to look at tonifying the Yong. So we'll start by tonifying a couple of the different Yong meridians in relationship to the emotions that are coming up. So one of the emotion that's associated with fire is the emotion of joy. And it's always interesting to take a step back and say, well, what is the function of joy? What is it telling us in our body? What is it telling us in relationship to the world? What is it helping us do? And if you think about all the moments in your life when you're truly joyful, these are the moments when you are the most connected to something. So joy's function is helping us to connect. Okay? So people who are having problems connecting, which is one of the big difficulties we're having now, is how to connect not only with our social media, this is a great platform, to get those deep connections that nourish us for who we are. And that's something that a lot of people now are coming to terms with, saying, I was connecting with lots of people on Facebook, but now that I don't have very much human interaction and I don't see people, I realize that that's not enough. And I need to go deeper. And one of the ways we can help them with that is by tonifying the Yong meridian associated with the emotion of joy, which would be the small intestine. So when we tonify the Yong meridians, we're going to use all Yong points. So you'll see here we have the small intestine points, we have the stomach points, the large intestine points, the bladder points, and the gallbladder points. And all of these points are, so when we're tonifying Yong, we use only Yong points, and when we're working with the Yin, we use only the Yin points. So what we want to do is we're going to use the same logic to find the points as we did with the lungs when we saw this type of pattern before. So we're going to say that small intestine fire is the weakened element where we need to bring more energy. We need to bring something else into it for it to help. So what are we going to do is we're going to look at the parent of fire, which is wood. So we look for the wood point, which is small intestine 3. And what we do is we tonify the wood point on small intestine. So we're going to be tonifying small intestine 3. And then we're going to have the wood point of wood help the wood point in fire to get that energy towards it, to get the Qi moving there. So we're going to tonify gallbladder 41. And these are going to be on the left side of the body, because that's the side that can allow us to tonify. And then what we want to do is we want to reduce the element of control and say that that element doesn't have as much impact on it. So we're going to be reducing the water, because water controls fire. So we'll be sedating small intestine 2, and then we're going to send that and give that energy back to water itself. So we're going to sedate bladder 66, and these are going to be on the right side. Okay, so our treatment is going to be tonifying small intestine 3 and gallbladder 41, and dispersing small intestine 2 and bladder 66. And what you'll also notice here, perhaps, is if you think about how the emotions and the Shen and etc. interact, is when we're not feeling enough joy and we're not accessing joy, what we want is for example, an emotion that will make us move outwards and connect. And the best element that has that effect is wood. Wood has that effect of moving outwards and upwards. And it also holds the Hun, which is our connection to who we were before. So we're bringing in this aspect of Hun into the fire. And what we're doing is reducing water. And if you think about, we're trying to get rid of that watered down experience of life. So by reducing the water here, we're bringing the water back to it. So we're bringing the Zu, the will just to live. We're reducing a little bit of the will and bringing in joy. So this treatment can be useful for people who are starting to realize their absence of connection at the moment, which is something I think a lot of people, from patients I'm talking to and other people, have been noticing, is that there's an absence of joy at the moment. So an absence of real connection. So this is a way of giving them more resources to be able to connect on different levels. Okay, so that's how we would tonify the small intestine with the Sa'am approach, specifically in relationship to a person who's having trouble expressing and feeling connected to the world around them. And now we're going to move on to the next element. And this is an element that when I talk to psychologists and I say in Chinese medicine, thinking is considered emotion, they get, I don't understand it. How is thinking an emotion? And I say, well, when we come back to this idea of what is the function of all of the emotions, we see it in a slightly different way. One of the ways that's interesting to see the function of thinking as an emotion is to go back to an older paradigm of the 5 elements. And the older paradigm is you had earth in the center, and then you had the other 4 elements around it. Okay, something like this. And so here we have the earth, okay, and then here we would have wood, we have water, we have metal, and here we have fire. So this is a more traditional, older approach to seeing the 5 elements. And what we see is that earth here is in the center, which means our thinking is our ability to receive the emotional information from the other elements and to digest it, to transform it into action, into a response. So this is why overthinking is we're doing that too much. We're not allowing enough feeling and we're just overanalyzing. But a lot of people go into a state of constant reaction, especially when things get too much for them. When they get overwhelmed with their emotions, they just go into react and they don't take that time to digest, to respond. And the earth element's role here is that's what it is. It's that central pillar that allows us to absorb the emotion, digest it, and then choose the response we think is most appropriate. Instead of just, I have anger, I respond with anger. I have fear, I go into fear. I have sadness, I'm just going to feel sad. Instead of saying, I feel sadness, I digest it. What am I sad about? What am I angry about? And this was especially true in probably the first week when everything was going crazy. Lots of people were just reacting. It was difficult to center ourselves or ground ourselves to be able to digest the emotions. So this is when the stomach often needs to be supported to help the body and to help us better respond to all the emotional turmoil that's going around. We can use the analogy of getting grounded is by tonifying the earth, tonifying the Yong aspect of the earth. So how do we tonify earth in the Sa'am approach? Well, in the UAT approach, what we do is we look at earth as being the stomach is the earth element, and stomach is nourished by fire. So we're going to look for the fire point of stomach, which is stomach 41. So we're going to tonify stomach 41. And then we're going to look for the fire point in fire and tonify that also. So we will be tonifying stomach 41 and tonifying small intestine 5. And these will both be on the left side. And that's going to bring in a little bit of fire. It's going to bring a little bit of movement, and it's going to help the earth. What happens when we bring fire into earth? It becomes solid and it becomes structurally sound. If anybody here works in clay, when you get the clay, you let it dry, it's very brittle. You put it into a hot kiln and it becomes very hard and solid and can withstand a lot. So by bringing in fire, we're giving more resistance and more resilience to the earth aspect. And what are we going to do is we're going to reduce the controlling aspect to give earth more ability to stand firm. And the element that controls earth is wood. So we're going to sedate stomach 43, which is the wood point of earth. And we're going to sedate gallbladder 41, which is the wood point of wood. And what we're doing is we're taking wood's energy and putting it back in the wood element. And then we're allowing stomach to absorb the fire to become stronger. So we'll be dispersing these 2 points on the right side. Now, what's really interesting, and maybe the idea of when we're sedating or tonifying an element in Sa'am, it's not so much that we're letting qi go out of the body. It's not like we're actually reducing wood's influence on the body. What we're doing is we're taking wood was spending too much energy trying to control earth. So we're returning that energy back to wood, right? So that's why the arrow is going back this way to wood, okay? So we're reducing wood's influence on earth, which actually brings wood's energy back to itself. And when wood's energy is back to itself, when it starts to function properly, it's going to start then sending its energy to fire. And then fire will continue to send its energy to earth. So by reducing the wood's impact, we're actually helping the whole system get back into play. Okay, that's what's so interesting about the SAM 4-needle approach, is that it's more of this holistic, all the elements are interacting with each other. It's not just using the tonification point on the stomach meridian. So it's not just stomach 41, it's how the 4 points all work together. And what we're doing here is we're reaffirming the Earth's place in the center, which is right here, okay? Keeping it solid. So that's a way of helping people stay grounded during this time or in any time. It's a very useful treatment to help people stay grounded in life from an emotional point of view. Now, one of the specialities of the UAT system, and this is very specific to the UAT original treatment, the original theory, and then applied throughout all the other ones, is we look at the beginning, and the beginning, for the first separation of yin and yang, is the separation of heaven and earth. So we've actually created a placement for heaven in our 5-element approach. And we're not going to put heaven here with fire. Okay, fire, which is traditionally, you have the heart and the small intestine and the pericardium and the sanjiao. In the UAT system, we only leave heart and small intestine in fire. What we do is we say sanjiao and pericardium are part of heaven. Now, there's lots of thoughts of why this, we can get to lots of reasons why we do this. We see the sanjiao has Yuan Qi, which is the source Qi, which is closest to heavenly Qi. The source point, the Yuan source point of pericardium is pericardium 7, which means great mound. And great mound was traditionally where they would go to get the mandate of heaven to reinforce the emperor. So there's lots of little hints that actually pericardium is a better association with heaven. And as heaven and earth, so here we have earth in this position here, but here we also have earth here. So earth would be in the ground and heaven would be above. So earth and heaven have a very similar, a very close link with each other. So in the UAT system, we're actually going to choose that sanjiao and pericardium are heaven, and heaven uses the same placement as earth, because one is on the ground, so earth would be on the ground. Let me just see if I can get this here. So earth would be here, and heaven is here, right? And then we as humans are in between the two of them. So here we have heaven, and here we have earth. And then we would have the 4 interacting, the other 4 interacting like this with our axis of heaven and earth. Okay, so we can see that heaven and earth are in the same position. So we're going to use the heaven point, the earth points, or the earth structure on the heaven meridians, which means that sanjiao here is going to be what we would consider a heaven element, but we put it in the earth position. So we see that we have the sanjiao meridian points here instead of the stomach ones like we had in the previous slide. So how are we now going to, why would we want to tonify heaven? I love saying that, tonifying heaven. Well, as we saw that earth was this idea of being grounded. So it's our cognitive, our cognition, our ability to think analytically. Heaven is our ability to think creatively, to be creative, to have not so much think, but to imagine, and that ability to be able to dream. And so we can have people who are lacking their being grounded. So we would need to work on the earth aspect, but we also have people who have a difficulty connecting to their own creativity and their own imagination. And this is something that's happening more and more as people start to get bored. Either they turn to complete boredom or they get into creativity. But if they don't get into creativity and they get further and further and further just into analyzing everything and reading every article about everything just to get the information without feeling it, that's at the moment when bringing heaven or bringing creativity is going to be very useful to them. So how are we going to do this? Well, we're going to do a very similar treatment as we did with Earth, except instead of using the stomach points, we're going to be using the Sanjiao points. So again, what element is going to be a tonifying element for heaven and earth? We'll stay with fire. So we'll look for the fire point, which is Sanjiao 6, and we'll tonify Sanjiao 6 in relationship to small intestine 5. So we have 2 points that we're going to be tonifying. We're going to be tonifying Sanjiao 6 and small intestine 5. We'll be doing these on the left side. And then what we're going to be doing is we're going to start reducing the overactiveness of earth of wood on heaven. So we'll be reducing Sanjiao 3, and we'll be reducing small gallbladder 41 on the right side. So here we have our 4 points of small intestine 5 and Sanjiao 6 on the left side to help bring in that fiery aspect. For the earth, it solidifies it, and for the heaven, it allows it to expand. And then we reduce wood's aspect of being, we reduce wood's aspect to allow that to fully function properly. So we've seen that we can tonify earth and we can tonify heaven. And when the person is really only in a sense of complete reaction and not response, meaning both heaven and earth are in a deficient state, and just the body is completely just going on automatic emotional responses, sometimes we want to tonify heaven and earth together. And if we look at the points that we came up with, we can see that they actually come together very well. So the points we looked at for tonifying earth, for example, so here we have the earth, right? So this is earth, and here we have the heaven. So when we're tonifying earth, we use small intestine 5 and stomach 41 to tonify earth, right? So we can write those down, but those are our 2 points to tonify earth, okay? And then what were the 2 points we used to tonify heaven? We used small intestine 5 and Sanjiao 6. So we'll write those down there too. And then we needed to reduce wood's aspect on earth. So we did that by stomach 43 and gallbladder 41. And we want to reduce wood's aspect on heaven. We reduce Sanjiao 3 and gallbladder 41. So now what we can do is we can bring these 2 treatments together, and we're going to see that we're going to have 6 points in total for treating heaven and earth together. So first what we're going to do is we need to tonify. So on the earth side, we tonified the Qi point, the fire point in earth, stomach 41. And on Sanjiao, we tonified the fire point in Sanjiao 6. And then what we did is both of them got that energy, got that Qi from the fire point of fire, small intestine 5. So we can tonify stomach 41, Sanjiao 6, and small intestine 5 all together. And then what we can do is let's look at the points to reduce wood. So you reduce the wood point of earth, stomach 43, and we reduced the wood point of heaven, wood point of heaven, Sanjiao 3, and both of them sent that energy, sent that Qi back to the wood point of wood, gallbladder 41. So we see here is that we have 3 points to disperse, and these are going to be all on the right side. And we have 3 points to tonify, and these are all going to be on the left side. Okay. And what's really interesting is when you, so this is a great way to help the person not only to be grounded, but also to be connected to above. You can think about it as you're using the Ren my one and do my one below, and Bach way above, and helping that connection come together. So we're connecting heaven and earth. And when you go into meridian interactions, you're going to see that what you're going to be getting is that you'll also be interacting with all of the yin meridians of the body, except for the heart. So you'll also be treating here the kidneys, you'll be treating the liver, you'll be treating the spleen, you'll be treating the pericardium, and you'll be treating the lung. So by treating all five of these meridians, the only one we're not treating is the heart, which we always want to say, try not to treat the heart if you don't have to. So by tonifying heaven and earth, it's also this great tonifying of all the yin aspects of the body, which help the person to be grounded and also help the person to react in an imaginative, creative way to the world around them. So that's a specific treatment for how to help people be, more solid and creative during this time. And the last emotional state that we can find that would be in a deficiency, I don't like to say a deficient emotion, but the patient is having trouble expressing, is related to metal. And metal is related to sadness. Now, what is the function of sadness in our lives? The function of sadness is about the ability to let something go. We are sad when we lose something and we have a problem allowing it to leave us, right? The physical aspect we're holding on to. Now, there's a lot of people who don't even realize that they can let something go. They just hold on to it and hold on to it and hold on to it, the hoarder. But a lot of us are hoarders in our emotional states, but we don't even recognize it. We don't allow ourselves to feel sadness. This is not about the person who's crying all the time and overwhelmed with sadness. It's about the person who is avoiding or not allowing themselves to actually digest and allow things to leave their body. So when the person is having this problem of not even recognizing that they can let things go, they think they have to hold on to everything because who knows when they're going to need it, is what we will do is we'll tonify the large intestine, because the large intestine is the Yong meridian associated with metal. And if you think about the function of the large intestine, it's to get rid, it's to allow what the body doesn't physically need, the food supply that it couldn't use, to let it go. So by allowing that to go out, it's the same thing with our emotions. So people who are, I say, emotionally constipated, tonifying the large intestine allows them to release that constipation, release and allow them to see that they can let go of their emotion, of their sadness. So the way we're going to do this is we're going to look in the metal element, and we're going to say we need to look for the nourishing element of metal, the parent element of metal, which is earth. So we're going to take the earth point of metal, which is large intestine 11, and we're going to tonify that with the earth point of earth. So we're tonifying large intestine 11 and stomach 36, and these are both going to be on the left side. And then what we'll do is, now that we're bringing in this movement to allow the body to start to let go and to realize it can let go, we're going to get rid of the part that's going to keep it hot, which is not allowing it to let go at all, which is reducing the liquidity or what it needs to slide. That's how I like to think about it. When the large intestine gets too dry, the stool can't leave. And part of that is that there's too much fire. So we're going to be reducing a little bit of the fire. And it's the same thing with the emotions. So we're going to look for the fire point in metal, which is large intestine 5. And this is going to be sedated. And we're going to look for the fire point in fire, which is small intestine 5. And this is also going to be sedated. And we're going to then put them on the right side because we are sedating them. So our treatment is going to be large intestine 11 and stomach 36 on the left side with a tonification of the needles, and sedation on the right side of large intestine 5 and small intestine 5. And when you think about the functions of the elements around this, if you have a blocked emotion, you're not letting something go. If something is blocked, right, like an old thing is blocked here, sometimes what you need to do is you need to put a little bit of oil inside of it, right? You need to put a little bit of grease. Earth's function is that idea of humidity, is grease. So by putting in the grease, you're going to allow something to be relaxed so it can start to move. And by removing the heat, you're going to be removing the friction, because friction is a result of heat. So by removing the heat, you're removing the friction to allow it to leave better. Okay, so that's this is not just now. This is one of the treatments I use really often in the clinic, because it really does help the patient let go. And a lot of our patients have a lot of problems letting go of what they've been accumulating. And at the moment, they're even accumulating more. So this is even more important now, but it's important all the time. Okay. And now we're going to move on to what happens when an emotion gets overwhelming and bogs down the system, where it becomes so strong that it is our only reaction to the environment. When this happens, what we want to be doing is we want to be reducing the yin meridian associated with that element. So a couple things I'd like to say about if you do reduce the yin elements, something to be very careful of is you want to be tonifying direct. You want to be seeing the patient very quickly after, 1 or 2 days maximum. Because when you start moving the yin and start allowing it to function in a different way, you have to then be able to help the patient to make sure if they do need some other help afterwards. It's this idea of when a tube gets so blocked that you remove the blockage. Well, there's going to be a lot of other things that have been happening because of that blockage that you need to look at. And often, once you remove the blockage or you help let the meridian express itself and not be so controlled, then we need to often tonify something else to give it some more energy. So the first emotion that I think most people, it's a little bit better now, but you still feel it very much at the moment, is a lot of people are paralyzed by fear. Fear has been probably the greatest emotion that people have felt over this period of time. And when that fear gets to a point where we're only responding with the fear and we see everything from a fearful point of view, then what we need to sometimes do is we need to look at dispersing the yin element associated with fear. So fear is associated with water. So the yin meridian associated with water is going to be the kidney. So I know it sounds strange in the idea of dispersing the kidney, but we're not dispersing the kidney and taking the kidney energy and throwing it out everywhere. The kidney energy has come to a point where it's blocked and it needs to start its general flow again. So when we disperse in 4 needle 5 element techniques, our logic is as such. We look at first what we're going to disperse and then what we're going to tonify. We're always going to have 4 needles. So the first thing we're going to do is the other part of the parent nourishes the child, is the child can accept the excess qi or the blocked qi from the parent and can actually transform it and use it. This was one of the theories of 5 elements. When you look at how, for example, wood tonifies or nourishes fire. If you put a lot of wood on fire, the fire can burn it and still use it. However, if you put a lot of wood in earth, put too many trees, it absorbs all the nutrients from the soil becomes barren. If you put too much wood over metal, it's going to rust it and break it down. If you put too much wood in water, it's going to create a dam. The only element that can absorb all of that wood is fire. So the only element that can absorb really all of water is wood. If you put too much water on fire, you put it out. If you put too much water on earth, you wash it away. If you put too much water in metal, you also get it to start to rust and it starts to decay. If you put too much water into wood, the wood has the ability to absorb it and to transform it and get its nutrients. So when we have this excess, we're going to look for the wood point of water to help let that fear go somewhere where it can actually be used and transformed into a useful qi in the body. So we're going to look for the wood point of water, which is kidney 1. And wood point of water is then going to look for the wood point of wood to help absorb where the water is sending it. So we're going to use kidney 1 and liver 1 on the left side in a tonification sense. Sorry, my mistake. It's going to be on the right side, and we're going to disperse them. We're going to sedate them. And then we're going to say is, okay, so kidney's fear element has started to go towards wood. And now we need to remind kidney of its proper function, of how it's supposed to be able to feel fear, but it doesn't have to always react to the fear. And to do that, we need to bring in that cognitive aspect of being able to discern what is happening with fear. So what is the element that controls water and also has this cognitive area? Is earth, right? We saw before that earth is the central pivot. So we're bringing in the central pivot into kidney. So what we're going to do is we're going to look for the earth point of kidney, and we're going to use that with the earth point of earth. So kidney 3 and spleen 3, and we're going to tonify this relationship on the left side. Okay, so we're going to be tonifying kidney 3 and spleen 3 on the left side and dispersing kidney 1 and liver 1 on the right side. And it's also important here to recognize is that kidney 3 and spleen 3 are both yuan source points. So you're bringing in that heavenly aspect of heaven through kidney 3 and spleen 3 into setting kidney back to its proper place. And you're allowing that excess fear that was there to go into wood, to go into the protective aspect, which we'll see after with wood. I saw that somebody raised their hand. Sandro, should I stop or should I answer that or should I continue first?
Oh, Jonathan, you can continue. Yeah, we'll look at the questions
and then we'll come back to all the questions.
At the end,
okay.
yeah.
Okay, perfect. So, as I was saying there, now the idea of dispersing kidney, I know it's sacrilegious to a lot of TCM practitioners, but we're not dispersing the organ function. What we're doing is we're allowing for a stagnant movement along the meridian and the emotional pathway that's associated with water to start moving again. So you don't think about you're depleting the kidney itself. What we're doing is we're actually helping the kidney function better by getting rid of a little bit of stagnation. It's similar to peeling off, you have, what's the best way to think about it is, sometimes you have to get rid of a blood clot for the blood to flow, right? So by getting rid of the blood clot on the kidney channel, you're allowing the qi to start flowing better throughout kidney and for that fear not to be so overpowering. Okay, so, but as I said, when we do this, because it's starting to flow again, we have to be very aware to come in right away after. So that's one treatment. Now, I've used this sometimes in the clinic. One of the times I notice it the most is after somebody has come out of a life-threatening problem. A patient, for example, after they've come through a kidney cancer type treatment, where they've had the cancer removed, they've gone through chemotherapy, they've gone through radiotherapy, and they're out of it. it can take them time to go from I'm no longer in danger and seeing everything as danger into restarting to build up their lives. So they can be stuck in danger is my only response to the world. And when danger is your only response to the world, that is when this fear starts to build up. So that's why we would sometimes need to reduce the kidney. And that's something that I think coming out of this, when you start seeing your patients back in your clinic, you're going to see a lot of them are going to need help getting out of that fear place. Okay, and another emotion that can be quite complicated at the moment, quite static, and this is the last one we'll look at before we look into treatments for how we would respond to COVID, is looking at anger. So anger's function, and this is important, anger does have a healthy function in the body. When we think of anger, we think of wood. When we think of the wood, we think of the general, we think of the military. And in a healthy, proper, or I don't want to say proper, but in a healthy functioning society, the military's job is not to attack, but to defend. It's the protection of the country. So anger's function is to protect the body, is to protect the emotions, is to protect who we are. Now, protection is important because sometimes we do need to protect ourselves. But when we see everything as a threat and we're only going to protect ourselves, and that's how we're going to respond to everything, we become inundated with anger, and anger becomes our only response. Now, at the moment, people are thinking about, I need to protect myself, I need to protect my family. People are, everybody's wearing masks and we're disinfecting, and everything is about protection, protecting everybody, which can be useful. And I'm not saying we shouldn't be protecting people. But when that seeps into our ways of responding to the world around us, as everything has to be protected and we can't take any risks, we go into a state of overprotection or being too angry. So how can we do this? We can reduce the amount of anger, or we can help wood let go of that accumulated qi and start seeing where it can go better. So as I mentioned before, when you have piles and piles and piles and piles of wood, the only element that can absorb them is fire. Fire can turn them into something useful, right? Too much wood, we saw what happened with earth, same thing with metal, same thing with water. But fire can absorb it. So we're going to start by sedating and taking the wood excess and moving it towards fire. And when we're moving away from an affected element, wood is the affected element here. When we move away from it, we use the sedation technique. So we'll look for the fire point in wood as the point that wood can start sending its excess out. So we're going to start by dispersing liver 2. And then it's going to send that excess towards the fire itself. And then we send it to the fire point of fire. So we'll disperse heart 8. And we'll be doing this on the right side. So we'll be sedating or dispersing liver 2 and heart 8 on the right side to actually start getting rid of this excess, or moving this excess amount of wood that we've accumulated, this excess anger, this excess need to protect ourselves, towards Shen, towards fire, towards joy. Joy can turn protection into something beautiful. Fire can turn wood into smoke and ash and everything that it transforms, right? Fire has this transforming effect. So that's why we're moving it towards fire. And then we also need to remind wood how to best respond to its environment. And to do that, we're going to bring in the grandparent, or the controlling aspect. And what do we do when we have bamboo's growth that's going too strong? Before we can send it to the fire, we have to cut it down. And what do we use to cut it? We use metal. So the metal's impact on wood helps contain it and helps show the wood when it is appropriate to respond with anger, and when it is appropriate to let anger and we don't need to protect ourselves and we use something else. So to do this, we look for the metal point in wood, which is liver 4, and we tonify liver 4. And what we do is we look for the metal point in metal, which is lung 8, and we tonify lung 8. And we do this on the left side. And what we're doing is we're bringing in metal's impact. We're bringing in a little bit of letting go, right? We saw before that metals, the sadness function is to let go. So bringing a little bit of sadness, just to remind wood that we don't always need to protect ourselves. We can also just let things go. And we take the excess and we move it towards fire. We transform it into joy, transform our protection into connection. Because when we're always protecting ourselves, it's very difficult to connect to something else. So we can see how the dispersion of the wood element and the liver meridian allows for us to move from protecting, aggressive, anger state into a more of letting go and transforming connection state, where we still hold on to the function of wood to protect us when we really need it. But we're helping ourselves understand when we really need it and when it's actually just an automatic reaction and we're not really protecting who we are. We're doing it because it's the way we think we should be doing it. And this helps us bring us back to that equilibrium, which is something that we're seeing more and more. I was reading documents the other day, is that domestic violence has gone up by over 100% during this period. Because a lot of people are in the state of constant aggressiveness. I need to protect everything about me. And if I can't protect myself, everything else is coming towards me. So now I'm going to act aggressively to all the people around me because I don't have the ability to let go. So I need to bring in the metal and I can't transform it into connection. So this is a really useful treatment for excess anger. Okay. And then, of course, you can get the liver Qi stagnation and all of the signs that go with it in traditional TCM. So that was a little bit about how we can interact with some of the emotional states that are either going on now with ourselves, our family members, also from a clinical point of view, coming out of this, how you can help your patients to just really realign themselves with what we're doing, with the situation, and working through all the emotional aspects. So for example, when I disperse wood in the clinic or when I disperse water, often the patient on the table will automatically start to feel a different emotion. So sometimes they'll become very angry, but in the middle of the treatment, they'll start laughing or crying, or they'll even have a little bit of am I okay? Is it danger? They'll have something else come in to start balancing themselves out. So our goal is not to get rid of the emotions. Our goal is to help the emotions move in a fluid and consistent way. So we can have that either from a point where the patient or the person isn't at all able to access that movement. So we need to tonify the Yong. And we saw that we can tonify, for example, connection to the small intestine, the cognitive ability to digest emotions through the stomach, the imaginative and creative ability through the heaven and Sanjiao, or put them together, to allow people to see that it's okay to let go through large intestine. And here we looked at when somebody is full of fear, how we can help them move a little bit away from the fear. And when somebody is full of anger with the wood, how they can move a little bit away from being only related to anger. And so that brings us to the last portion of the course for today, which is probably what most of us are thinking about. So how do we treat patients who have a Tai Yong invasion and then the recovery? So Tai Yong is probably the first level of most viral infections. One thing I would like to remind you is that, of course, this, at the moment, we're not in the clinic, so we shouldn't be using it in a clinical setting at the moment, unless you're working in a hospital setting. And second of all, we're taking this from a TCM point of view. So we're not treating any particular viral infection. We're treating the idea of viral infections in TCM. And the first level of that is the Tai Yin, Tai Yong approach. So this is linked to the Tai Yong stage in the 6 stages. So we have fever, aversion to cold, stiff neck, sweating, shortness of breath. So we see that this is very similar to what is happening now, but it's not necessary. This is a treatment that's been going on for thousands of years. So it's not specific to this, but this is how we would be treating it now. So how we would treat somebody with a Tai-Yong affection. Well, when we think about the levels of meridians in the UAT system and also in the French energetic system, we look at them a little bit differently. We go from the Yang levels above and the Yin levels below. But then what we do is we look at the amount of sunlight that each meridian gets, and we say the most amount is on the top, the medium is in the middle, and the least is on the bottom. So the levels go from Tai-Yong to Yong-Ming to Xiao-Yang, and then we go to the Yin, the Tai-Yin, the Shui-Yin, and the Xiao-Yin being the lowest. So here we have the highest level of Yin and the highest level of Yang. Okay, the most amount of sunlight on the Yin meridians, which is the Tai-Yong, that's the bladder and that's the small intestine, and the most amount of sunlight on the Yin meridians, the the lung and the spleen, Tai-Yin. So we're going to take these 4 meridians and we're going to create an I Ching Bagua treatment out of it. So we're going to follow the same logic that we did at the beginning when we saw the Tai-Yin Yong-Ming to help us better defend the Wei Qi. Here we're going to see that we're going to be using Tai-Yin Yong-Ming. So we're going to put our Tai-Yin meridians. So we have lung and spleen. So we're going to put them opposite. So if this is going to be the right arm, the spleen is going to be on the left leg. Okay, of course I can inverse them and put the lung here and the spleen here. So we have lung and spleen. So we have the Tai-Yin. And then we're going to put the Tai-Yong, small intestine and bladder. So our 4 meridians are lung, small intestine, spleen, and bladder. So we can see here, if we look down here where I've actually put out the points for you, first of all, we can see that lung interacts with bladder. This is through a system of midday, midnight, and also Tai-Yin, Tai-Yong, right? So the exposure to sunlight. So for me, that would be system 5 in the UAT system, midday, midnight, and system 6, exposure to sunlight. Small intestine interacts with spleen in the same relationship between Tai-Yin and Tai-Yong, exposure to sunlight. And lung and spleen interact with the full meridians, Tai-Yin of the arm with Tai-Yin of the hand, of the leg, and bladder and small intestine from the Tai-Yin, Tai-Yong of the arm to Tai-Yong of the leg. So we have a structure. We have the yin-yang, yin-yang structure. We have the meridian interactions, which create a strong structure for them to interact with. And when we do the I Ching Bagua analysis, we come to see that we have what's called a 1-4 pattern. So it's going to be the first point and the 4th point going from most distal proximal. So the 1 point would be the first point, or the Ting point. So bladder 67, spleen 1, small intestine 1, and lung 11. And then we have the Jing River point, or the 4th point. It's not always the Jing River point. It can also be the Luo point and sometimes be one source point. So we have bladder 64, spleen 4, small intestine 4, and lung 8. Okay, so there we have 1-4 pattern. So again here, we're only using points at the wrists and the arms, and the leg and the feet, and just in the feet. So we have lung 11 and lung 8 on one arm, and then on the opposite arm we use the yin, the yang, small intestine 1 and small intestine 4. The arm where we had the yang, we'll put the yin on the same side, so we'd have spleen 1 and spleen 4. And then on the opposite leg, we'd put bladder 67 and bladder 64. And this is a treatment that will help for the body to release the exterior, to allow the viral infection, which is at that first level, to get out. Okay. Now, if viral infection gets deeper and deeper, there are other treatments. I didn't want to go into them here because I didn't think that they were, at this time probably that would be more herbs or something else, because the person really needs hospital care, especially now. There are other ways to do it with acupuncture, where we can use a Xiaoyong type approach. But this is probably the best approach for us at the moment when the patient first gets a Tai-Yong type viral infection. So here you have a treatment idea for that. The other thing we have is what happens after this is all gone. And there we can look at how to readdress the body, how to bring the body back to equilibrium. We've gone through the attack, we have digested it, and we have used it. Notice I don't say that we defended against it. I don't think it's a confrontational approach. It's about learning the body and the attack, both learning, and the external influence, both learning how to live together or how to function together. So at the end, what we want to do is we want to realign, well, we can say it's realign fire and water, realign heart and kidney. So to do this, we're going to use the Shaoyin Tai Yong approach. And so here we can have the indications, the general indications of the dorsal aspect of the body, occipital headache, back pain, but it's also useful after a viral infection has passed, and realign the kidney and heart communication. So we're going to take the meridian Shaoyin, which is heart and kidney. So we'll put heart on one side and kidney on the opposite. And then we'll take the Tai Yong, which is small intestine and bladder. So we have heart, small intestine, kidney, and bladder. Now here we have each meridian here interacts with all three of the other ones. They're going to interact on system 1, which is called interior-exterior, heart to small intestine. Heart is also going to interact with bladder through that closed circuit meridians. The back yin meridian of the hand will interact with the back yang meridian of the leg. And then we have heart and kidney, which are both Shaoyin. Shaoyin of the hand interact with Shaoyin of the foot. So we have this full box of all connections. They all interact with each other. When we analyze the I Ching and we compare the guas, we come to a 3-6 pattern. So we're going to be using the third point coming from distal aspect. So bladder 65, kidney 3, small intestine 3, and heart 7. And we're going to use the 6th point, which denotes the Husi point near the knee. So we have heart 3, small intestine 8, kidney 10, and bladder 40. And this is a good treatment at the end. Also, if you think about it, we're doing the whole back of the body. So you're doing the bladder, you're doing the small intestines, you're doing the heart and the kidneys. And this is going to help the person to become upright again. It is our back that holds us up straight. So here we're creating more of a vertical support on the whole back. So that's why this treatment at the end, the Shaoyin Tai Yong, is very useful afterwards, because you're bringing things upright. And that's normally the last step in a recovery. So we can use this at the end here. So when we look at the idea of patterns versus viruses, colds, external pathogens, we have 4 different possibilities. So the first one we saw was the Tai Yin Yong Ming, which we used as a way to build up our protection against the exterior. Okay, so here we have the top level of yin with the middle level of yang. So we have Tai Yong Yong Ming. And this is to build up the Wei Qi to help us protect ourselves. Then we had the Tai Yin Yong Ming. So we have the top level of yang and the top level of yin. And this is for these Tai Yong stage external attacks, viral flu, and other types of external, very virulent external attacks. And then we looked at what to do afterwards, the Shaoyin Tai Yong, after illness realigns yin and yang. I didn't include the Zhui and Yong Ming because it's not really relevant to this situation. It can be used, but it's not really what we're looking at now. So we do have this in the I Ching system as a 4th pattern, but it's not what I was showing you today. So that is pretty much what I wanted to share with you. We saw that we went through how to build up the Wei Qi, or how to help us respond to the environment, all the different emotional problems or emotional imbalances, and how we can either support the body in tonifying yin meridians or dispersing tonifying yang meridians or dispersing yin meridians, and then a treatment when a patient is confronting with a Tai Yong type attack, and how to help them afterwards using Tai Yin. And so that's pretty much where we were going today. So so now we can open it up if you have any questions, or I'm more than happy. I got through it all.
Perfect. Thank you, Jonathan. Thank you very much. So we're going to start going to the handheld. Raise your hand in the digital again, guys, just to remind you to do that. Jonathan has several lectures on healthy seminars that are on sale during the isolation lockdown. Use coupon code HEALTHY25. Just want to remind you for that. And if you like this style of acupuncture. And also, please keep checking out daily the healthyseminars.com resources page, because we now have, let's just see here. I'm going to put up the resource page.
You want me to stop sharing my screen?
I'll cover. Perfect. So go to Healthy Seminars resource page. We're always adding stuff. I just want to let you know that as of this recording, we have another 11 work in process that's going to be listed in the next 48 hours. Okay, so keep checking. If you're looking for this kind of valuable content, we're always adding what we consider valuable content. So let's go to hand raises, because we only got a few minutes here. So we're going to go to Lauren. And Lauren, I have unmuted you. I think so. Let me do that. Guys, I don't have. There we go.
So I have two quick questions. The first is, what's your preferred way of tonifying and dispersing? Do you use gold, silver? Do you use rotations, needle gauge?
So normally what I do is I use insertion on breathing out for tonification, and taking out while the patient is breathing in. So dispersion would be the opposite. Going in quickly, going in slowly for tonification, taking out quickly, and going in quickly for dispersion and taking out slowly. Normally that's pretty much, I use that and the direction of the meridian. Those are the three main that I use. What's good about the Salm approach is that you don't have to be too focused on tonification dispersion, because the points themselves function in that way.
Well, so that leads to my second question. I was trying to write so quickly and I didn't quite get the order of the last protocol that you said, which was the Tai Yin Tai Yong. Was it, what was the order that you wanted?
Okay, so for the I Ching Bagua treatments, the order isn't important, because all the points come together. It's only for the 4 needle 5 element ones that we need to be concentrating, that we do tonify first, then disperse. Because the I Ching Bagua doesn't have any tonification or dispersion. It's just about interacting.
So do you do them, then you use the same needling technique for all?
Yes, just a simple put it in and leave it. You don't even have to get the Wei Qi, because the needle, just make sure you get in a little bit further than just the skin level, and that's it.
Lovely, thank you so much.
Yeah.
And I want to remind you guys that you can review this lecture for the next 48 hours. Again, go to healthyseminars.com/resources to look for the replays. And I want us now to unmute ourselves, and let's give Jonathan lots of love and appreciation for putting this together. And I want to send my gratitude also to Jonathan and to Lorianne and Sandro, who work endless hours behind the scenes so we can keep bringing you this content. So thank you to the team, and thank you guys for showing up to create that community, which turns into unity and immunity. All right, let's send each other some love. Say hi to each other. You'll notice your picture will come up as your voice gets caught. Go for it.
Thank you so much.
Thank you. Thank you very much. Thank you.
Thank you.
Follow. Thank you.
Good presentation.
Thank you very
Great
much.
presentation.
Thank you so much.
Thank you at the same time.
Thank you for all of you. Thank you so much again. Thank you.
Over every single day.
Thank you.
Gdybym znała to wszystko zrozumiała, to jest bardzo proste, jest co on gada. Tylko widzisz, Yang Tain. On mówił, że trzeba umieć, bo jak się posługuje, no przede wszystkim bardziej nagrany czas. Wiedzieć, co to jest. Atelu.